Welcome to Big Butts, No Lies. I'm Mavi, your go-to guide for everything plastic surgery. With 18 years in the industry working alongside top board-certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full-on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the episode for you today? I am super excited to bring on a patient coordinator. You guys know I love my coordinators, and I'm super excited to have Darlene Comstock from Park Rebowe Plastic Surgery in Mobile, Alabama. And you guys are in for a treat today because Darlene comes with 28 years of experience in everything that has to do with getting you ready for surgery. Thank you for being on the show, Darlene.
Absolutely. Thank you for having me. I'm super excited to be here today.
Yay. So, girl, in together, we have so much experience with what has happened in the industry, the ups and downs over the last 20 years, and how everything has really changed, right? From 20 years ago, nothing is the same anymore.
Absolutely. In such a big way, but it's been fun. The evolution of plastic surgery in this 28-year span has it's been amazing. It's been fun to grow with it, see the changes and the outcomes at what the changes can bring, the positives. It's been pretty amazing.
Absolutely. So I always talk about on my show how I love being part of the transformation of women, from
Yeah,
meeting them at
absolutely.
their consultation and walking them through surgery, and then watching them come in at their 6-week post-op and their 8-week post-op, and just feeling like completely different women. And when I was reading your form, I saw that that's part of what you love too.
Yes,
So I'd love to
yes.
hear a little bit more about that.
Absolutely. It's like my favorite part, but I love people. And when a woman comes in to have surgery and she's quiet and bashful and a little bit scared to be there and she doesn't want to disrobe, oh, I just want to wrap my arms around her and give her a big hug and say, it's going to be okay. I say this all the time, we as moms sacrifice our body. We dedicate our lives to our home, our husbands, our children, to give them a wonderful life and a happy home. And in doing so, we tend to let ourselves go. And that's across the board for most moms, right? So once they get their children to a place where, okay, my kid's good, like what happened to me? And then by that point, they're usually very self-conscious about it. So when they come in, it is my job to make them feel okay about it. And it's okay that you're here asking for these things. And then once you see that wall break, that glass drop, and they're like, okay, yeah, okay, it's okay to feel this way. Um, so then when they go through the process, they do the consultation, they meet with the surgeon, they commit to the surgery. Like you see, each stage is so amazingly touching in such a big way, lots of emotions. And I get so excited for them. And I make sure they know how proud I am of them for doing such a small thing to help them feel better about themselves. It's not for show. It's not for their husband or anyone else. It's to make them feel good. And then to have surgery. And I always go back and see them that morning. If I'm not in their surgery, I make sure I go back, give them a familiar face, and tell them how amazing they're going to look after. Then I check on them after surgery, say, I know it's rough right now, but it's okay. You're going to get through this. I saw you before we put the dressings on, and you are going to love it. and just building them up the whole time. When they come in for their first post-op, some of them are, still a little bit weepy at that point. By 6 weeks and 3 months, I mean, we're like, we should be throwing a party at those visits because they feel so good about themselves again. And that is my favorite part, is how life-changing this is for a woman, both physically and mentally, emotionally. All of it just goes so well together. And to see a woman just shine after what felt like a huge undertaking to them is heart touching. Like, I could talk about it for days. Literally, could talk about it for days. And everywhere I go, if somebody says, "What's your favorite part of your job?" All of it. However, let me just share with you what my favorite part is. So
And
yes,
that's my favorite part
absolutely.
too.
Yes, it's the best.
I've always loved watching just a woman transform from that
Yes,
shy, they don't really want to take their clothes off, just like you said,
yes,
to when they come in at that 6, 8 week visit and they're like wearing a sundress and they got heels
yes,
on and they have their hair done and they got makeup on and they're wearing their perfume and they're just
yes.
strutting down the hallway, going down to the exam room. Like, I love that.
Right. Yes. The part that they were so self conscious about that we wanted to look at, to touch, take photos of, now they're so happy to show you again, or now. And yes, it is amazing. A lot of patients say, "I feel good about myself again." And some of them will say, "I didn't hate myself, but now I feel like I have my body back. I have me back." And that
I
makes
feel
the
like
world
my
better.
self
It makes them, yes, like it makes them feel good. If they're a better mother, they're a better wife when they feel good about themselves. All of their world just comes together nicely.
I love that. I want to touch something today with you that we as coordinators or people in the industry, we know, but for our listeners, it might be something that they've heard of it, but they don't really understand it. And that's going to be realistic expectations of what the surgeries can actually achieve versus what they dreamed up in their head of what everything's gonna look like.
Or the photos they've seen. Why can't I look like that? Yeah, that's as you well know, a huge part of our job, and such a very important part of our job is making sure before they commit and pay for a procedure that they fully understand what they're going to get. And it's tough sometimes. It really is. It's probably the hardest part of my job, honestly. Um, Many women come in and they say, "I don't expect perfection," and that's good because we can only do so much with certain things. We can certainly improve a lot, but there are limitations in some categories. And making sure those patients understand that it is really hard sometimes, but with lots of talking, a lot of hand holding, and trying to find photos of similar before and show them where that patient ended up. And to say, you may look at this and still see asymmetries or something that you feel could be better, but let's not lose sight of where we started. And that's the most important thing, is where did you start? And what foundation do we have to work with? We can make anything better, but what they think is better and what's realistically better is sometimes two totally different things. And
Absolutely. You know what I like to do with my one-on-one girls? I have them send me their before pictures and their wish pic. Kind of like,
yes,
okay, this is where I'm at, and this is what I wish I could look like. And
Yes.
then I get them on on a Google Meet, and I share my screen, and we look at them together. And I go through their wish pics, and I tell them, this is realistic. This is not gonna this is not achievable with where you're
Yes.
starting. This person hasn't ever had surgery. This is a gym body. This is not
Right.
a surgery body. And
That's
I
right.
think that's a lot of where confusion happens, where sometimes women are expecting what they see online, but the person that they're seeing online works out 6 days a week, like
Right.
doesn't eat carbs, has a super
Yes.
clean diet. Their
Strict lifestyle.
body is their life, is what they do for like
Yes.
their living. They make sure they take care of their body. And maybe the person who is looking for the surgery like doesn't really work out, hasn't worked out in 10 years,
Right.
has a diet that isn't ideal, or whatever the
Right.
case may be. Maybe the person, this is what a lot of what I think women out there are seeing is they look at pictures of women who have just had liposuction, or uh, just a little bit of work, and then
Right.
but they actually need like a full abdominoplasty, extended abdominoplasty. They've had
Right.
kids, they've had all, so it's not comparable, right? It's apples to oranges. You can't
That's
really
right.
compare those two.
Correct. Yes, absolutely. I do the same thing. I like to see, I want 3 photos of what you really like. And if you have a photo or two of something that you do not like, that helps me too. But it's pretty common that their photo that they really don't like ends up being something they do like after we talk about it. Breast augmentation is probably the most common one where their photos and what they're saying don't go together. Like, I want this, but I don't want to be a D cup. Like, well, this is really a D or double D. This is, so that's like, it's okay to say D cup. Some women just have that fear and phobia of saying D cup. That's really big. Actually, it's not. If you like this photo, be okay with saying that. If you find a bra you like, cut the tag out so you don't see that letter. Because if this is what you like and want in the end, it's going to be an easy D cup breast, but it's okay because it fits you. It looks pretty on you. It's getting over that mental component of that block of, oh, D's too big, C's midline. So, or
Absolutely.
with tummy tucks, that visceral fat. I don't want that round tummy. Well, let's talk about what we can do before we commit to surgery. Let's see what we can do to help you lower your BMI, which will help that visceral fat so that we can give you more of what you're looking for. So there's,
Such a good point you brought up there. The visceral fat, the getting stuck on CCs, or like, I don't want to get
yes,
an implant that's too big. Like, they get stuck on the number, and they're like, my friend, she got a 325 and they look so good on her, and I want a 325 too, but maybe their chest is wider. Maybe
right,
their frame is completely different, and a 325 will look tiny on them. And those are
right,
the types of things that patients don't really realize until
right.
you explain it to them, until
That's
we
right.
break it down. Okay, let's talk
Yes,
about this. And that's why I feel it's so important to have a really good relationship with your coordinator, with your doctor, so
yes,
that you can have the open communication of like,
right,
this is what I like, this is what I don't like. The surgeon can tell you this is realistic, this is what the limitations are, and everybody's on the same page.
right. Absolutely. So important to have that relationship where you can be open and honest with your coordinator because she is your middleman a lot of times. And so, yeah, agree 100% with that.
So, one of the things that I also want to touch on, because you've been in this industry for such a long time, and I want you to give me a behind the scenes of how has how have things been different since the Miami boom as far as phone calls, as far as price shopping, as far as what you've seen as far as complications. Like we know the Miami boom happened, but the people who listen to this show don't know the repercussions of that Miami boom.
It's a big deal, and we see it. I'm sure it's all across the U.S., and it's a big deal for us. We see a lot, unfortunately, and it's sad. Two things. One is there are some women who go there who are getting acceptable results, and then they share the word, and a lot of people, of course, say, well, she went there and only paid $5,000 and got all of this,
$5,000.
right? And got all of this and looks amazing. Well, let me tell you about that one versus the 20 who did not, or came back with major complications from surgery that were life-threatening, to be quite honest. And then they had exhausted all their financial means by going to Miami with the surgery, the travel, all the things included. And now you're back here with significant complications that need medical help, but you don't have the money now to fix it. All the money you've now spent from start to finish, you could have had it done by a real board certified plastic surgeon in a safe manner with minimal complication risk compared to what you exposed yourself to. We all know there's no such thing as zero complication risk. It's real, and we do not dismiss it. It's anywhere you go, but it's making sure you're in the right place so that those are as minimal as possible. So I have to be careful. I can get off on this real quick and easy. So
Go for it, because our
yeah,
listeners don't know. But when I started this show, my goal was to let the our listeners, the patients, the women who are looking for surgery, I wanted this show to be like listening to conversations that are happening in the office of things that we know are happening and what's going on, but the general public doesn't know. Because I launched this show right in the middle of the pandemic. And
wow,
in the middle of the pandemic, it was a boom. It was bad. And
yeah,
one of my motivators was how many women I was seeing come to our office that were having complications from having surgery in Miami. And
right,
the amount of knowledge that was missing, I was like, there's nobody out here telling them the truth. Some of those people are not even doctors. Some of those people
yes,
are are not even who you are meeting for your consultation is not even the one doing your surgery.
yes. Like, in what world do you think this is okay? Never is there a time you do not meet the surgeon who is going to be performing your surgery ever. Not even 5 minutes before the surgery is okay. You need to form that relationship, meet him long or her long enough to know, do you feel like you can trust this person? Like, how do they look? Do they look presentable? How do they speak? Do they tell you the pros and the cons? Because everything comes with cons, everything has risk. You need to hear it. And if they're not telling you, that tells me that they're really not wanting you to hear the negatives because they're afraid that they'll run you off. Well, we want you to know the negatives. It's important. You need to know what you're asking for. That happens so frequently. I recently had a patient come in who went for a consultation in Miami. She presents to our practice for abdominoplasty. Her BMI was 43. And they did a consultation, virtual, gave her a price quote, encouraged her to select her surgery date, and they just so happened to have a cancellation like 2 weeks later. And I said, "Ooh, how much time do you have?" I said, "Let's talk. With you presenting here today, I'm not saying that you're at a dead end. because you're not. We just have a speed bump that we need to slow down for. We're going to cross it, and then we're going to continue on our journey. And our speed bump is right now is our BMI. Let me tell you why it's so important you want to slow down for that. And I listed all the reasons that a high BMI proceeding with body contouring is so important, and you don't dismiss that. We're going to help you. I'm here for you. I will be your biggest cheerleader along the way. I don't say, oh, go lose weight, come back and when you're ready. No, come visit me. Come in once a month. Let me give you a big hug and tell you how good you're doing. Let's talk about what you're eating. Let me refer you to a dietitian. Let me refer you to a weight loss program that I believe in. We're here for you. We're committed. We're not going to take you currently, do this massive surgery, which exposes you to so many more risks, and say, oh, go back 5, 10, whatever hours and let somebody else deal with your problems. I say this all the time. Most women who sit in front of me or I'm on the phone with, I say, the fact that you are a beautiful human being created by God is so important to us. You're typically sometimes a mom, a daughter, a best friend, a sister. All those titles in life are way more important to us than small breast or loose skin on your tummy or whatever's bothering you. Those are our most important things, is that you stay those titles in this life and as healthy a version of those titles as you can. Miami does not look at it that way. They see a dollar sign and that's all they want. They do not care about you as a person or as a human being, because if they did, they would not be doing the things they do. You need to be, as a patient, where you are cared about. The safety is first and foremost. Even if you pay an extra few $1,000s, sometimes when I've compared price quotes, it ends up not being a lot more, if any, having it local with a real board certified plastic surgeon than going to Miami, because you've got travel expenses and then they hit you with all this back-ended stuff that they don't tell you about ahead of time. So it is so important to do your homework. Just because she got a great result, well, I'm happy for her. I really am happy. She is blessed that she came out on the good side, because not everyone does. So it has taken lots of new conversation on because of the lack of respect and how do I say it nicely? Respect for a human being and their life, them as a person. And people dismiss the fact that it's not that they dismiss it. Patients don't realize how important those things really are. They think, oh, they're a doctor, they're going to care about me. They don't. They really don't. If they did, they wouldn't be doing the things they do. And most of these practices aren't physicians anyway. They are non-physician people trying to make a living and hurting people by doing so, more times than not.
And you know what? Speaking about that one who had an amazing result, I've spoken to plenty of them because I do my free discovery calls and I talk to women from across the country.
Right.
And they'll say, I'll talk to somebody who I just talked to somebody last week actually, who said, "Oh, my friend, she went to Miami. She paid $5,500 for her surgery. And she came back and she looks amazing." And I was like, "Well, how was her experience?" She said, "Oh, well, she was in the hospital because that she had to have a blood transfusion because she was losing blood. She was losing so much blood. And but the doctor took care of her. They sent her to the emergency room and they did all the," and I was like, the fact that y'all
Wow.
think that's oh, she's fine. She just needed a
Wow.
blood transfusion. Like, that's okay. The fact that she needed a blood transfusion is a huge red flag. It's a
Yes.
huge, this is not normal. And I think I've said this before on early on episodes where I had somebody called who was price shopping, right? And she was like, "Well, I'll go with you guys so I can stay local." This was when I was a coordinator. She said, "I'll stay with you guys so I can stay local if you throw in the blood transfusion for free too." I was like, "The blood transfusion? Like why would you need a blood transfusion?" And she was like, "Well, the office in Miami, they will, if I need a blood transfusion, it's included in my price." I'm like,
Oh
well,
my
you shouldn't.
goodness.
That's like a huge complication. That's not something that we are preparing for because it's something that we hope does not happen, and we hope to not see that, and that would be a major complication. So I'm like, in the last 15 years, I have never seen a patient need a blood transfusion after liposuction because we don't do that type of surgery.
Right.
And it
We
was just
do
such an
safe
eye.
liposuction.
Exactly. We do safe liposuction. So that conversation back then, this was like 2019 probably, just really opened my eyes to like,
Right. What they're doing.
it's it's the Wild West out there. It's
It
really
really
the
is.
Wild West.
Yeah. It really is. Probably the number one procedure we see that came from Miami is BBL. And people think, oh, it's simple. We're going to take some fat out of my stomach, give me a flat stomach, and we're going to inject it in my buttock, and boom, I'm happy. Yeah, does sound good, and it can be done that way. Yes, but we are seeing major complications from it because Miami is about 12 or 13 hours from here. And many of these women are driving down. Well, guess what? They're having to drive back on a fresh BBL. They don't know anything about a BBL pillow. They don't know anything about pressure reduction on this fresh injected fat. So they show up back in Mobile, Alabama, a week later with major fat necrosis, infections, wounds, septic. I mean, they're sick women, very sick women. And we take care of them because, I mean, who else is going to, right? And we care about them. We want them to be okay, but it's not fun for sure. It's not fun at all taking care of someone else's problems. So,
You know the saying, cheap plastic surgery is expensive.
yes, 100%. It will always cost you more by going somewhere like Miami or a non board certified plastic surgeon who doesn't know plastic surgery to the nth degree like a real board certified plastic surgeon. You're increasing your risk for complications by doing that. With complications comes a higher expense. It's part of it. We
Exactly. You know
accept
what,
those in a
Darlene?
good situation.
I want to get, because I have to make this argument all the time of like, okay, a board certified plastic surgeon is completely different than a cosmetic surgeon. So I'm sure that's a conversation that you have had to have hundreds of thousands of times. Give me your explanation. Explain it to our listeners. What, in your opinion, is the biggest difference, and why should somebody choose a board certified plastic surgeon versus a cosmetic surgeon who has amazing results on Instagram and has before and after pictures galore of like amazing work that they do? Why? What's the difference?
You sure you want to open this can of worms? I'm extremely passionate about it. So when I started my
Me
career,
too.
the surgeon that I worked for many years, 1997, took me under his wing and never see a cosmetic surgeon, and this is why, and all the things. So fast forward 28 years later, and a cosmetic surgeon is typically a surgeon. They are a surgeon. They are an MD typically, or a physician. I'm sure there are some DOs um, who did not do a plastic surgery residency. They did not go through the proper channels to learn to do cosmetic surgery. Maybe they're an oral surgeon or a podiatrist or OBGYN who are probably very good in that specialty because that's what they were trained as. However, when they start dabbling in cosmetics, it's for cash pay. Okay. There's only one reason you do it, and not do it the correct way. Being trained at an accredited facility, taught how to make something better and help that person in the event they have a complication that we all know are risk of what we do. Everyone is going to have a complication at some point in their career. Typically, they're minor, but you need to know how to fix it and take care of it if you have that. Most cosmetic surgeons don't know how to take care of a person if they get a small seroma or hematoma. I mean, they can technically do that, but they can make it pretty, but they can't fix it if it's broken. And making it pretty is questionable many times in my eyes because they know the blanket of what they're trying to do, the outer shell. It's the inner parts that mean the most, that can ultimately is what gives you that best outcome, not just the shell. It's all of it going together, from muscle tightening to proper liposuction and what areas is safe to do with an abdominoplasty, to progressive retention sutures. So your incision stays right where your surgeon wants it to be. The detail in what our surgeons do versus what a cosmetic surgeon does is exponentially different. You cannot compare the two because a board certified plastic surgeon is by far way more trained and capable of getting you to the end result with a great result with as few with by lowering your risk. Or if you have a problem, they can help you and they know how to help you. Yeah, it
Yeah.
is. Yeah, I have to
So
be. I have to be very. I have to be cognizant of what I say when on this subject.
I agree because it's something that I'm very passionate about, specifically
Me
because
too.
I have seen a lot of complications caused by cosmetic surgeons, complications and just ugly, bad results.
Bad
But they charge about the same.
or more.
So,
We have one local that charges more, and the results. I don't even have words. Like, come on, what part of this woman standing in front of you are you dismissing? Because she is a beautiful woman who's trusting you, and this is what you're giving her. And sometimes we can't fix it because of how he did it to begin with.
mhm.
Yes, the patient will say, well, can you not just do this? No, because that blood supply has now been cut. The blood supply has been altered. If we do this, your skin is going to turn black and die. You're going to have wounds. And then when it heals, you're going to have a big, ugly scar. So you can thank that cosmetic surgeon who was cheaper than us or charged more, but gave you this. It's tough.
But was a
It's
better
really tough.
salesman.
Right.
So one of those things that I'm very passionate about that I knew you were going to be passionate about was this topic specifically,
Yeah.
because as a coordinator, it's like we're fighting for our lives here, like, but it's not really my life, it's your life. I'm
Right.
fighting for you, like your result, for the way you're
Yes.
going to have the experience that you're going to have. But you're arguing with me, but I'm trying to
Yes.
teach you. I'm trying to explain it to you. And
Right.
I've even had one of the things that I do is I produce podcasts for plastic surgeons. And you know this, Darlene. So
I love them too.
one of the conversations that they were having on the Confidence Doc podcast between two board certified plastic surgeons was that the cosmetic surgeons, they're like, oh, well, plastic surgeons are only doing like reconstructive and they do like more insurance cases, and we
Right.
focus specifically on cosmetic. And what
Yep.
Dr. Rednum said, she was like, I'm pretty sure if I can reconstruct a breast and turn an abdomen into a breast, or reconstruct
Yes.
a body, I can put it together beautifully. Like
Yes.
there's no question about my skill of making something beautiful just
Right.
because I know how to reconstruct it. Like that makes me a better surgeon.
Right. Yes. We hear that all the time. They must like feed off of each other and are taught the same to say the same thing. They're all parrots, I think. They say, "Oh, we're cosmetic surgeons. That's all we do is focus on making it pretty," which really makes them sound very uneducated, to be quite honest. Um, they're great used car salesmen. They really are. I don't have
Yeah,
any
they
other
really
words.
are.
They are a
And
great
the
used
funny
car
thing is,
salesman.
whenever we say do your homework, something as basic as type that surgeon's name in on Google and just search lawsuits. Like how many people has he hurt? And I bet you if you are looking at a cosmetic surgeon in Florida, you might start typing their name on Google, and the word at the suggestions at the bottom, you know how it gives you a bunch of suggestions?
Yes. Yes.
Those suggestions will already be there of like that certain surgeon's name and then the word death or
Yes.
lawsuits or injuries or different things like that.
Right.
That if me specifically, if I'm looking for a surgeon
Right.
and those Google searches are already there,
Yeah.
immediately no.
That's right.
Immediately no.
That's exactly right. And every patient that comes in that I speak with, I tell them how to look for a surgeon, the avenues, the American Board of Medical Specialties. You know, you don't want to go to your heart surgeon to have your knee replaced, and you don't want to go to your OBGYN to have your heart surgery. This is the same thing. Why people don't look at it like that, I don't know, but it is exactly the same thing. If you're an oral surgeon, yeah, he could probably help you with any oral issues you have. If they are an OBGYN, they're probably phenomenal at that, and they can probably help you with those issues. But stay in your lane, do what you're trained to do at an accredited facility, and let's keep America safe and our women and our moms who are just trying to feel better about themselves.
Absolutely. You know, one of those things that also I want my listeners who are listening today, when a surgeon, a board certified plastic surgeon, the majority of the time they have privileges at hospitals in the area where if they have a patient who has a complication, they can admit that patient and take care of that patient in the hospital, right?
That is
When
correct.
a cosmetic surgeon cannot do that because they do not have the accreditations that the hospital requires in order to give them the ability to take care of that type of procedure or those types of patients in that hospital. And
That
that
is
is a
correct.
huge, huge thing that a lot of people don't think about.
If you are a cosmetic surgeon in Mobile, Alabama, you cannot go to there's not a hospital in the city that would allow you to come in and do cosmetic surgery if you are an oral surgeon or an OBGYN, et cetera. You can get privileges in your specialty.
Mhm.
Unfortunately, The reason we have one in Fairhope, Alabama, which is where I'm at today, the hospital made an exception to the rule and allowed this guy privileges as a cosmetic surgeon. There's a lot of backstory behind it. Another surgeon who went to bat for him, and they changed the rule for him. But that's the only hospital around that will allow that. Nowhere else, Mobile or Pensacola. We're in Baldwin County, right here in Fairhope, right in the middle of Mobile, Alabama, Pensacola, Florida, and this person can't go to either of those big cities and get privileges at a hospital as a cosmetic surgeon. Unfortunately, it's been made allowed here. So therefore, people think, oh, well, he can go to the hospital and operate. Yes, but let me tell you the story behind that. So it's a struggle on that part has added a new component to helping educate. Like, yes, but that still doesn't mean he's qualified. So, yeah.
Well, Darlene, our listeners are so blessed today to have been able to have you on and just talk about all of these things that we know, right, behind the scenes, everything that's happening that our listeners don't know and potential patients don't know. And I really enjoyed having you on and just having a fellow coordinator to just chat and talk about these things with.
I have enjoyed every second of it. I'm so passionate about it. I could sit here all day and talk. And I love, especially with someone like you who walks in my shoes and you get it and you know, and I just thrive off of it. Even after 28 years, I still can't get enough. Like I never get tired of it. It never gets old. So it's an awesome career to be in for sure, to be able to help women who want help and know that it's doable and can be done safely.
Absolutely. So if our listeners want to come talk to you, want to see you, how can they get a hold of you?
Yes, they can call our office at 251-340-6600. It's the Park Rebowe Clinic for Plastic Surgery. We're in Mobile, Alabama. We have a couple of satellite offices, one being in Fairhope, Alabama. And we can accommodate any way we need to for you. Sometimes just that consultation, we can do different hours because you're not 100% sure this is right for you, or even if you're a candidate. So I'll meet with you and just talk you through it. And doesn't mean you have to commit, but it's nice to get answers. And that way, if you should proceed with your thoughts or not on having this done.
Thank you so much for being on the show. And with that, you guys, I'll see y'all next week. Thinking about plastic surgery, but you don't know where to start? I've got you. With 18 years in the industry and experience working with top board-certified plastic surgeons, I help women like you make informed and confident decisions. Whether you need help choosing a surgeon, planning your recovery, or understanding what to expect, I've got your back. Skip the guesswork and get expert guidance by booking a call with me today. That's a wrap for this episode of Big Butts No Lies. If you found this episode helpful, do me a favor and subscribe, leave a review, and share it with a friend who's considering plastic surgery. Until next time, stay confident, stay informed, and remember, big butts don't lie.